like to bring up Jim McClellan, who is the Indiana State Drug Prevention Treatment Enforcement Division drug czar, if you will, and reports directly to our governor. Jim?
Thank you, Katrina. You know, a few minutes ago, Katrina, you said something about looking out and seeing all those smiling faces. There isn't anybody here who has a bigger smile on their face than you right now. So congratulations, and thanks for all the work that you've done to make this a reality, along with a lot of other people who've been working with you. And I just want to say I'm just really pleased to be able to be a part of this celebration, and to add my own personal thanks to everyone who's played a part in making it a reality. All of you are aware of the terrible toll that addiction has taken on individuals, families, and communities all over the state. This opioid crisis is being felt in cities and suburbs, small towns and rural areas, and it cuts across all the socioeconomic lines. And from the outset of his administration, Governor Holcomb has made attacking the drug epidemic one of his very top priorities. I can tell you he's very serious about that. And nothing has been more important in that effort than expanding timely access to services that will enable Hoosiers with substance use disorders to recover as fully and as quickly as possible. But through a $10 million State Department of Health grant from the Ryan White program, the opening of this center here is a big step forward in making such services more available to people, certainly in Fayette and surrounding counties, but I know that some of the individuals that you're serving come from farther away than that. This new 46-bed detox unit will help patients receive comprehensive, individualized treatment on the path to recovery with special attention given to those with HIV. But just as there are multiple paths to addiction, so too are there different paths to recovery. But I will tell you that everyone in recovery needs a strong support system, and that's where people from the healthcare sector, state and local governments, faith-based and other community organizations, businesses, and caring individuals can come together at a local or a regional level to support persons who are in recovery as they seek to become or return to being productive, contributing members of their communities. And I'll tell you, one of the things that we got a sneak preview of this center before lunch, and one of the things that I kept hearing, I kept hearing some words and some phrases that really resonate with me in this whole topic: compassionate care, holistic, often whole family. This is what we have to do, friends. We have to bring pieces together. We have to work with the whole person, often with the whole family. And as we do that, making the most of our collective resources, we're simultaneously helping to build stronger and healthier communities for all of our citizens. So with the continued good work of people such as all of you, with the work going on by so many others in many parts of the state, and the encouragement, understanding, and support of others, we are going to end this scourge that has been destroying lives, devastating families, and damaging communities all over Indiana. And we'll do it in far less time than it took to create this crisis. So thank you. And I'll tell you, a lot of you have been helping in that arena for a long time, longer than I've been involved in it. And I just want to say thanks to you too. And I know Senator Merritt's sitting right over here, and he's been a champion of this for several years now. And there are several others here who've been working on this issue and really attacking it for a long time. And we're making headway, folks. We are making progress. We got a long way yet to go. But I just want to thank all of you for what you're doing. Congratulations again on the opening of Northstar Recovery's Detoxification Substance Abuse Treatment Center. Best wishes for much success in your work to help save and improve lives. Thank you.
Thank you, Jim. So we're going to keep moving because I know you're all excited to see the units and get to the tour. So at this time, I would like to bring Kevin Moore, who is the Indiana State Division of Mental Health and Addictions Director, and really my new partner. He just doesn't know yet how much work we are going to do together. So thank you, Kevin.
Thanks, Katrina. For those of you that have partnered with Katrina, please let me know what that means. So, I'm a little scared. It was right at 2 years ago. I got a call from Representative Zimke, And she said, you need to come to a meeting in Fayette County. I said, all right. She says, there's a group going to be meeting at the hospital, and they're going to talk about the addiction crisis in Fayette County and how it's impacting Connorsville. So I come down with our legislative director, and we walk into a room, a conference room filled with people, stakeholders from the community, folks from the hospital, folks from the treatment side, folks from the town, people in recovery, treatment providers, recovery providers, all talking about their role that they think they could play in addressing this issue in Fayette County. And I left thinking, wow, they've got the right people at the table. There's certainly a lot of passion in the room. And that guy with the West Virginia drawl really seems to be able to motivate folks to do the right thing. And I think that's what got us here today. It takes many people and multiple approaches to get to this point. So congratulations on the opening of the Northstar Recovery Center. It is beautiful. And I think the folks that will be here and will receive treatment and care here, it will be life-changing for them. We know that substance use disorder is a chronic disease that is treatable, and we know that recovery is possible. We hear the stories every day of people maintaining recovery. They got treatment somewhere. They got detox somewhere. And that somewhere is going to be right behind us for a lot of folks. There's much work that has been done and much more to come. We've put together packages of state funding and federal funding, and we have additional federal funding coming towards the end of the year to help us address the opiate crisis in Indiana. Money's not all of it. Money's a big part of it. But it's the commitment of folks to recovery, and it's the reaching out to our neighbors that gets that started. So we must ensure that there continues to be access to timely, evidence-based treatment. That's why through our Cures dollars, we have focused on training providers. We have worked to expand access to medication-assisted treatment. We have trained peers to work as recovery coaches, and we have implemented mobile addiction teams in 14 counties across the state to make sure those services are available. Most exciting, there's a new platform available just in the last 90 days called Open Beds that allows a provider to sit down with someone looking for a residential bed and in real time be able to find a residential bed across the state. Your beds are part of that system. The exciting part of that is the connection to Indiana 211. Any citizen I could call and say, I'm ready, my spouse is ready, my son is ready, how do we connect? And Indiana 211 has access to that open bed system as well and connect people to residential care, and that will continue to grow across the state. So thank you for being here to celebrate today's opening. This unit will provide great comprehensive services for individuals with SUD and HIV. It complements Fayette's already terrific services for adolescents and the medical care provided for the community. They've seen great success with the youth over the years, and I'm confident that the adults that will come here will achieve that same level of success. Randy, you started a great journey. Katrina, a great journey has been initiated here, and I want you to know that we are with you every step of the way, and we look forward to great things to come. Thank you very much.
Appreciate it. And now again, when I said we've got great guests, I mean we have great guests. So I want to introduce you to the lovely Dr. Christina Box, who is the Indiana State Health Commissioner, and we speak frequently together, and I always hate to follow her because she's so eloquent and I'm so not eloquent. But our passion is the same, and we are so blessed in the state of Indiana to have this lady leading us. So, Dr. Box.
I always say if I can just bring half the passion that Katrina has for what she and Randy and the team have been able to do over here, then I will be able to make great changes across this state with the help of everybody in collaboration. You know, as Jim said, it's a sobering thought how many thousands of Hoosiers that have died from drug overdose. But today is a day of joy and happiness. It's a day to celebrate a community coming together to address those needs. Really the #1 hospital in the state that is actually saving lives every day from drug overdoses. The grant funding for this detox center started through a simple discussion. Randy and Dennis talking about, your dream, and Dennis saying, hey, could we work together? Maybe we can partner this with HIV because we need beds. And then when I met Randy, I'm like, are you going to include pregnant patients? Because the obstetrician in me is always looking. And they have really always listened to the needs of their community and addressed those. And that's why this is going to be such an amazing program here. The grant funding is named for Ryan White, who is a young man who faced an incredible amount of stigma in his life associated with HIV. Although this epidemic that he faced was 25 years ago, our epidemic today, individuals suffering for substance use disorder face that same kind of stigma in their communities and across the state and across the nation. And that stigma is one of the primary reasons that individuals don't get into care. When I was in medical school and residency back in the 80s, we were just finding out about this disease, had people in the hospital with this disease, and really the public thought of that as just a disease of gay people. And so when poor Ryan White got this, no one knew or talked a lot about the fact you could get it from a blood transfusion or get it from heterosexual contact. And his family faced, as did Ryan, a lot of stigma associated with it. For instance, he wasn't welcome back in his school. He had trash poured on his lawn. He had a bullet shot into his home. So overcoming that stigma today for substance use disorder is what this community is about, and overcoming that prejudice. Individuals suffering from substance use disorder, as I said, face that similar stigma. And campaigns like Know the O, and treatment centers like Fayette Regional, and most importantly, communities like this community are actually doing the very best they can to replace the stigma of substance use disorder with the hope of recovery. I've seen firsthand the effectiveness of how medication-assisted therapy for individuals that are caught in the throes of substance use disorder makes a difference. It reduces the brain's need for opioids and decreases those mitigating withdrawal symptoms that individuals have. The effective use of MAT therapy under the care of a healthcare provider, they're so blessed to have such an amazing provider joining them here. It diminishes the risk of relapse. It keeps the patient engaged in recovery and allows them to function normally within their society. And in combination with counseling and mental health therapy and community-based wraparound services, which they're working so hard to provide here, and recovery housing, we can actually make a difference and let these individuals take their lives back from substance use disorder. Another very important component in our toolkit for substance use disorder is syringe service programs. It's vital in our comprehensive approach to combating substance use disorder. Syringe service programs not only allow further touches so that individual has a higher chance of getting into treatment. We know evidence-based knowledge shows us that individuals are more likely, if they're involved with a syringe service program, 5 times more likely to get into a treatment program. It reduces the spread of infectious diseases like HIV, hepatitis C, and hepatitis B. And syringe service programs cost pennies compared to the amount of money that we spend on these preventable diseases. And so we must utilize our complete evidence-based toolbox as we help many Hoosiers to take back their lives. Through your efforts, as you offer specialized treatment to individuals with substance use disorder and HIV, I know we're going to help individuals in this region of the state, and probably the western region of Ohio, the southern region of Michigan, the northern region of Kentucky, the entire Midwestern area, to break this grip of addiction and to find their path back to recovery. So thank you very much for all that you've done, Katrina. So important.
So really the man of the hour now is Mr. Dennis Stover with the Indiana State Department of Health Division of HIV, STD, and Viral Hepatitis. And like was mentioned before, a conversation started, and we have another really important key component here today that spent a lot of time with Dennis and his division, and that is Kelly Yance. Where's Kelly at? Where'd she go? She was here. But we don't want that to go unrecognized either as she moved forward, and she was very important. So Dennis, would you please come?
Katrina thought she had a hard act to follow. I'm following my boss too, so you know, what can I say? I want to start by thanking a group that I haven't heard thanked yet, the board of this hospital. Would the board members of the hospital that are here today stand and receive the applause you deserve? I started working in HIV before Ryan White and traveled with Ryan and Jeannie through their journey. So I know about that stigma. I know about harassment calls. I know about threats. And you know, we've moved a long way. And a couple years ago, the health department convinced me to come back. And I thought, well, great. I love working in HIV STD. And then there was Scott County. And we dealt with yet another mitigating factor of stigma related to folks that are getting infectious disease because of their drug use. And that's very unfortunate, but let me tell you, Scott County put us on the map for the country. It has given us resources we would not have had in our communities to really get in front of the opioid crisis. Leadership, like we said, with our senator sitting up front, who's really been an outspoken person in the legislature. Our hospital association is here today. You know, there are very key people that are paying attention to this at the most important levels, people that are policymakers and change makers. So when Randy had that little sidebar conversation, we're over here with Dr. Waltho, who's now the FFSA Secretary, Kevin's boss, and we're over with Dr. Waltho, and Randy had a hidden agenda. He brought us over here for universal testing in the emergency room for Hep C and HIV, but his big agenda is about this recovery center you're going to see in just a moment. So Randy, I applaud you, Katrina, the staff, the new doctor that's joined you, the 6 nurse practitioners and the many volunteers that you gathered already. One of the conversations Randy and I had early on is, I don't know if I can find the right staff. I don't know if I can get the right staff. Well, Randy's probably going to tell you, but I'm going to steal his thunder. He's got the right staff. And he's looking at not this as a state model, county model, but a Midwestern model that is going to be second to none. And I applaud Randy and his staff for that. A big round of applause for them. Although I like being the man of the hour, the man of the hour has a really wonderful team that works with him, and I want the entire team that's with me today, my directors within STD, surveillance, training, prevention services, and Hep C that are with us today. And we have a Hep C epidemiologist with us today too, so stand and be noticed. Thank you. Opiate, I'm sorry. Randy has gotten to know every one of them because he's tapped into every resource they have. Tony, our trainee director, spends about every other day in Connersville. Randy has trained every one of his staff in the hospital in HIV 101. He has immersed this culture with what's going to happen with the recovery unit, and that's to be applauded, Randy, so I thank you. HIV folks are our first priority for this center, but it's really to serve everyone, and we know the need is there. Jim mentioned it earlier. Jim McCullen, before he had to run off he's leaving here to go to Fort Wayne to be on a panel, so he's a very dedicated and committed man, so just so you know that. Again, I thank the group that's here today and applaud you for what you've done, but I know the work is yet to come, and the work will be so gratifying, so rewarding. I've not met a more positive, energized hospital unit folks in the country, and I've been in a lot of them. I've worked in several places around the country with a lot of hospitals, but bar none, Randy has a team that he's assembled and a contagious energy and activity that's going to make this a success. Hospitals are drivers in communities. They're economic drivers. So we walk in, there's the economic development folks with us here today. There's the USDA here today, health departments, family services. He has all the right people that he's talking to really make a difference in this community. But not just for this community, but for the folks they're trying to serve and get into recovery and become a profitable margin for their city and their county, because those folks have a lot to offer once they get their brain fixed. It's a debilitating issue that they're dealing with. But once that gets fixed, and we talk to recovery folks all the time, it makes a huge difference in how communities survive and thrive. We have the syringe support program in this community is transitioning, thank you board again, to the hospital as well. So the connection with syringe support services, that's good. I stand to talk about those in communities that aren't applauding me when I'm done, so it's good to get applause. Again, I thank you again. Thank you for your commitment. The community, thank you for your embracement of this program and the programs that will grow out of it. And we're off to some fun soon, right, Katrina? So back to the mic, Katrina. Thank you, folks.
Thank you, Dennis. The team has been fabulous, and we just cannot say enough about all of the good work that has been brought out here to our hospital employees and to the community, so thank you very much. Unfortunately, Jeannie has been hospitalized, so I'm with a heavy heart today that we had planned and arranged this meeting for her to join us today and really honor Ryan's legacy. But we did speak with her. She did want to express that she was extremely proud of this project, and for us to honor Ryan's legacy, we did ask her permission to show a video.
I think the first time I ever heard the word AIDS and knew anything about it was in 1984 when I seen a gentleman in a hospital bed on his last breath of air. He had just wasted away. And I remember him talking and he couldn't even hardly speak. And that's the only thing I ever remembered about it. I never thought I was going to have to be concerned or worried about this disease, so I paid very little attention. My son Ryan White was born in 1971 on December the 6th. He weighed 7 pounds 8 ounces and really skinny, but had the biggest feet. And he was circumcised. I didn't know anything about hemophilia at the time, but then they come back and said that, you know, they can't get him to stop bleeding. They put ointments and all kind of stitches and everything on him to try to get it to stop bleeding. Finally, they transferred him to Methodist Hospital in Indianapolis, and that's where the hematologist told me that Ryan was a severe hemophiliac with less than 1% clotting, and said it was very serious. He told me that he'd never be able to play contact sports and he'd never be able to have any surgeries. They said if he's ever in a car accident, the chances of him living will be 0. So as a mom, being first diagnosed, I was like a nervous wreck, and he said, now I want to tell you some good news. He said, we have this new drug that's not approved by the Food and Drug Administration yet, but with your permission, we'd like to give it to your son. He told me, he said, we feel like this drug will enable hemophiliacs to live almost a normal life. So I was like, oh my gosh, yes, you can, give him Factor, And they said, it has to be given by IV. And I said, that's fine. To be told that your son has a severe condition that most are crippled by the time they're 12 and don't have a long lifespan. I mean, I felt like this was a miracle drug for us. Factor VIII contains a clotting agent found in blood. They pour several pints of donated blood into a container. It's spun real fast and the clotting is sucked out. That clotting is used to treat hemophiliacs. For 2 years, when he was 3 years old, on Tuesdays and Fridays, we would go to the doctor and he'd get Factor. And it made our life so wonderful. I mean, we just dealt with hemophilia. It wasn't an obstacle anymore. And then when he was 5, they asked me if I wanted to learn how to give Factor. And I thought, oh my gosh, that's going to make our life even greater. So whenever he had a problem or a bleed, I would give him a Factor. If Ryan had a joint bleed or something serious to where he needed an ACE bandage or crutches, you'd have to give Factor VIII every day. You'd have to give it almost every day for maybe a week or 2 weeks for it to clearly heal up. But as a preventative measure, we gave Factor VIII twice a week. The problems I think we dealt were mostly with knees, ankles, hip hemorrhages, elbow hemorrhages, and bruises all over his body, and being questioned by hospital staff. How did he get all those bruises? I think that's kind of common because, I mean, you'd never know how they got those bruises. They would just appear. I mean, Ryan was always had like 100 bruises all over him. In 1984, Ryan was very sick, very, very sick. He had to go to the doctor quite often, 4 or 5 times that year, because he had fevers and everything. And I got a message the 1st of December that said that Ryan had hepatitis. And I thought, well, that's why he's been so sick. But it was just a few days after that He got off the school bus and he come in the house and he said, "Mom, you got to do something." He said, "I can't even get off the school bus without being tired. Mom, I don't understand what's going on with me." And it was just a few days later, he couldn't hardly breathe. He started running high fevers. They put him in the hospital. He was diagnosed with pneumonia in both lungs. They treated him for bacterial pneumonia and he never got any better. Finally, they sent him by ambulance to Riley Hospital. Dr. Kleiman met me, the head of infectious disease at Riley Hospital, and he said, "We feel like Ryan might have TB, cancer, or AIDS." And I mean, I knew nothing about AIDS, but I just assumed that it had to be cancer or something, not that I wanted him to have cancer. And they said they wanted to do a biopsy, and I said, "Well, Ryan's a severe hemophiliac." I said, "He's not supposed to have any surgeries." And Dr. Kleiman told me, he said, "This child's going to die if we can't find out what's wrong with him." So I signed the papers. Ryan went into surgery. There was no AIDS test at that time, so they sent the results to Denver, Colorado, where the results came back that he had pneumocystis, which said he had AIDS. When Ryan was diagnosed with AIDS, he was only 13 years old. We were told that he only had 3 to 6 months to live. He was diagnosed with AIDS on December 17th. So it was the day after Christmas. I really wasn't planning on it, but I said, "Ryan, you know you've been really sick." He said, "Yes." I said, "They say you have AIDS." He said, "Am I going to die?" I said, "Ryan, we're all going to die someday. We just don't know when." He goes, "Let's pretend I don't have it." I said, "Ryan, we can't do that because we have to take these precautions to keep you from getting sick." My daughter, Andrea, she goes, "Mom, that's not what he means." And Ryan said, "See, Mom, she knows me better than you." He said, I don't want everybody that enters this room or to see me, that sees me, to say, 'Poor Ryan, he's dying.' He said, "I just want to go ahead and go on with my life, okay?" I was so angry at Factor and everything about the whole process, and I asked Ryan, "Ryan, if you knew Factor had AIDS in it, would you still take it?" He said, I would. He said, "Mom, it kept me out of a lot of pain." And, you know, so as much as you have this hysteria about upset and mad about it, to ask the person themselves, because I don't think people can realize how bad that pain is. I would rub his knee just continuously as light, and you just couldn't do very hard at all, or else it would just, you know, he would scream out. So then he had 3 teachers that came down to visit him, and they brought cards and letters from his classmates, and I said, "He will be so excited that you're here." And I said, "All you have to do is put on these gown and gloves and you can go in and see him." And they kept saying, "No, that's all right." I said, "No, this is for his protection." And they said, "No, we'll leave the cards and letters out here." And then you just start noticing everything. You start noticing the panic in everybody. I seen it very early on how people treated Ryan, like he's had to have done something bad or wrong or he wouldn't have got this disease. This is God's punishment on people who do bad things. And there's some funny things going on in that household. That's how he really got AIDS. And we can't let Ryan White in school, or every gay person in the country is going to come to our town. And you saw the religious community especially, not wanting to confront this disease. Even my own church, who I taught Sunday school for 10 years, 2 to 4-year-olds, and I'd been going there to this church my whole life. To see how the Christian community even reacted was just overwhelming to me. How, when I thought my faith and my support team would always be my church, and to see that it was not there. I called the National Hemophilia Foundation because I knew how it had to affect all hemophiliacs. And I knew if Ryan was infected, we all got our factor from the same place, they all had to be infected. And their comment was, "We're a hemophilia foundation, not an AIDS foundation." And they said, "I'm sorry, we cannot draw attention to our hemophiliacs having AIDS." One of the best things that happened when Ryan was in the hospital, Dr. Kleiman told me, he said, "I know you're a strong Christian lady, but the people fighting this disease and trying to do something about it is the gay community." So he gave me the number of AMFAR. I called AMFAR, and that was the best thing I ever did, because on the other end of the line was a gentleman by the name of Terry Byrne. And Terry Byrne became my guardian angel. He said, "We're finding out here in New York far sooner than anywhere else what works and what doesn't work." He said, "Believe me," he said, "any time you have a question, you call me no matter what time of the day or night it is." So, and I did. I spent many hours talking to Terry. That was one of the best things, because it put us in communication to a lot of people that were fighting the disease too. Ryan got to where he looked so good, you wouldn't even tell he had AIDS. He kept calling me and about bugging to go to school. And he says, Mom, he said, call the school, see if I can go visit. They have pizza on Friday, and I really like the school's pizza. I called Mr. Colby, and Mr. Colby says, call me back after spring break. I called back after spring break. He said, Ryan can't even come to visit school. He said, have you talked to the local Board of Health? And I said, the Board of Health? He said, yeah. He said, I think you better call them. There's people that's been wanting quarantine signs put on your door. He said, but you need to hear it from them. They're going to vote in July whether to allow Ryan in school for next year or not. He said, just be patient until July. July came, the end of July came, we get a call from CBS Morning News. It went over the wires that the school board voted on the 15th not to let Ryan in school for next year. So that's when it just broke loose. The media, the chaos. I mean, we couldn't even answer the phone because the media, they were camped out at our doorstep, people wanting interviews with Ryan. None of it was kind of planned, but at the same time, I think Ryan thought he had a chance to explain and to try to educate people. First of all, we fought the school, the teachers, and the principal. They voted unanimously to keep Ryan out of the classroom. And then he fought the school parents and the school kids. So it became a long, long battle. I mean, we thought it would take one court hearing. We had all these medical experts on our side. We had the CDC and famous infectious disease doctors. And the first court hearing, we realized that was not going to take place. They had doctors testifying that they wouldn't let their kids go to school with Ryan, and they wouldn't treat Ryan if he'd been a patient of theirs. The fight to go to school really lasted for like a whole year after that. Ryan was finally able to go back to school, he fought, but the prejudice was still there. Kids would just, make fun of him. Kids would, you have AIDS, don't touch him, don't touch him. Ryan had a separate restroom. He ate off of disposable eating utensils and trays at school. These were concessions we made to kind of help maybe meet everybody halfway, but the prejudices was still there. So Ryan calls me from school, and I said, what's the matter? He said, when somebody's been in my locker. When I open my locker, my books and folders all have fag and other things in them, wrote on them. And I said, Ryan, give me the principal. And he said, Mom, he's not here. He said, they're at a meeting at another school. I said, give me the vice principal. He said, Mom, they're at a meeting at another school. I said, Ryan, there has to be somebody at that school. He said, Mom, there's a secretary here. I said, Ryan, give me the secretary. I told the secretary, I said, I've never called a press conference in my life, but I'm about to call my very first one. You have 5 minutes to get him a new locker, a new folder, or I'm going to have every media in the country at that school. And Ryan calls me back about 10 minutes later. He goes, Mom, everything is cool. He said, I got a new locker, I got new folders. He said, really, Mom, everything is okay. We moved to Cicero, Indiana. And that's when our whole lives completely changed. The first day we moved in, 5 kids stopped by the house to introduce themselves to Ryan. We didn't know this, but the student body president lived 3 doors down. And when she heard that we were moving into the neighborhood, she went to the school, the principal, and said, let's make Ryan White welcome here. Not the parents, it's the kids that got behind Ryan, and they went home and talked to their parents and said, I know how you get AIDS and how you don't, and I'm not going to get AIDS from Ryan White. I had 3 moms that stopped by and said, if you ever need anything. Our house in Kokomo was the AIDS house. I mean, nobody ever stopped by our house. Ryan, for the first time, he said, Mom, I feel like I've got people fighting this disease with me. He said, I'm not fighting this disease alone anymore. His whole life changed. He went to proms, he went to dances, he had a girlfriend, he had a job at Maui Skateboard Shop, and I can remember him coming home telling me he had a job at Maui Skateboard Shop. I said, well, how much are you getting paid? He said, $3.50 an hour. I said, that won't even hardly buy your gas to Indianapolis and back. He said, Mom, you don't get it. I got a job just like everybody else does. Ryan made a difference, I think, because of his honesty and that smile. He had a smile that made people listen. And I think he had honesty to tell the truth and to just try to educate people. A lot of kids made fun of him and said, you have to be gay or you wouldn't get this disease, So I think he saw how the gay community was being treated, and he didn't want anybody to be treated that way. The hemophilia community now, I see a split. I kind of see people that kind of don't want to be reminded all the time about all the deaths and all the bad things that happen with factor. But I think at the same time, when you deny something, it makes it so it doesn't exist, and it did exist. This is a part of our heritage that within the hemophilia community, we have to honor and respect those that went through this horrible blood holocaust. I mean, that's exactly what it was. This was a whole community that was wiped out. They had moms and dads and families and aunts and uncles and brothers and sisters. Too many people were lost that we loved, and it affects people even still living today. I had this mother, I want to share this story because a mother called me and she said, I have to talk to you a minute. My husband and I, we fight all the time. We were trying to protect our little boy. He was like 5 or 6. He was a real young kid. She said, we fight over who knows and who doesn't know in our family. My little boy just starts screaming at us. Stop fighting. I know I have AIDS. I know I have what Ryan White has. And this woman was saying, you know, I'm just so sorry we didn't do this sooner. I'm sorry I wasn't there for you. Everybody thought they were doing the right thing, but we wouldn't come together. The hemophilia community, this was a disease that we were all sharing. We were fighting AIDS and hemophilia together, but it was separated. There was like a line drawn. I love seeing that joined now. I think we need to be one. We need to be and share our stories and be able to communicate with people the sadness and the sorrow, but also the joy that maybe nobody has to live with this again.
So at this time, I would love to welcome Krysta Gibson. She's representing the Fayette County Chamber of Commerce, and she's going to come up and say a couple words and lead us through our formal ribbon cutting to open Northstar.
Thank you. Good afternoon. It is a pleasure to be here this afternoon for the grand opening of Northstar Recovery. This is a much needed service for our community and surrounding areas. This 46-bed facility offers services for those struggling with addiction. On behalf of the Fayette County Chamber, I would like to congratulate all those who have worked hard and have been passionate about helping those with addiction. This is also a special occasion for Fayette County. The Chamber is here for the community and its residents, and we are honored to take part in the ribbon cutting today. The Northstar Recovery will give those who seek assistance the opportunity to rehabilitate themselves as well as be productive citizens. The opening of the facility will provide much needed employment opportunities as well as assistance to our residents. I am pleased to be the president of the Chamber and look forward to working with all in uplifting Connersville. On behalf of the Chamber, I would like to thank you for coming to this momentous occasion. I would like to invite the special guest speakers, the hospital administration team, Fayette Regional Health System Board of Directors, Northstar Recovery staff, Mayor Harold Gordon, Franklin County Chamber Executive Director Rhonda Brown and President Gene Moster, and any other designated dignitaries to join me in the ribbon cutting. Thank you.